This training is about the annual wellness visit for our straight Medicare physicals. This is for straight Medicare only. The visit will start with booking an appointment. The appointment will be listed as an annual wellness visit. Patient engagement will be scheduling all the appointments for these patients needing these Medicare physicals. In the morning, you're huddling up, working as a team, reviewing the schedule to see how many annual wellness visits you have, getting ready for the visits, reviewing any gaps in care, and watch for any alerts. For the support staff, the RN or the MA, there's some important things to remember for the annual wellness visits. First off, it needs to be specialty family practice, and the visit type is Medicare preventive. This is very important. You can see a list here that there's other things that need to be considered for this type of visit. The patient has a pre-visit checklist. You're going to need to do vitals, as usual, activities of daily living. Even if it's already been done this year, activities of daily living are required for this physical. Advanced directives will need to be addressed. Vision and hearing screenings can be done if the patient is complaining of vision and or hearing issues. And then a depression screening will be done. This is a geriatric depression scale similar to the PHQ. In fact, the PHQ here is also acceptable. For our female patients, it is required that we put in the post-menopause date into the vital signs template. We need to do a cognitive assessment, mainly the slums. Also, the timed up and go will be done by the RN or the MA, along with the fall risk. If an RN is available, they can complete the review of systems. As usual, vital signs, medication reconciliation, allergies, histories, BMI should be done. The Medicare Annual Wellness Visit has its own template called Medicare Straight AWV. This template is selected under the HPI. When this template opens, it has several panels through which the documentation is entered. So for the RN or MA, whomever is supporting the clinician, after the visit is done, as per usual, items will be ordered, such as follow-up appointments, completing the labs, generate the patient plan, generate any patient education, and if possible, send all that to the patient portal. On the clinician side, the documentation is going to be done on the SOAP. Please check that it is Medicare preventive, and we encourage you to check the HCC link at the top of the template. These conditions should be addressed, even if it means you are resolving these conditions. Sometimes you may see an alert regarding capturing these HCC codes. The reason for visit has already been added by the support staff. It's going to be Medicare Straight AWV. So you should go through the template, reviewing all the information that's been added. The nurse has not already completed the review. If the nurse has not already completed the review of systems, you can go ahead and complete that as well. A quick save is a good idea here, just to speed up documentation. History should be reviewed and updated as needed, and the detailed document button should be selected for each item of history. As always, address vital signs, meds, allergies, etc. You do a physical exam. Again, this is a great place to take advantage of the quick save. Once you've completed the physical, you're going to address the HCC codes as mentioned previously. So you can click back in to see what conditions need to be captured. These are important because the higher the risk adjustment factor, the higher the reimbursement for the patient, meaning that if the patient has a lot of complex conditions, we are reimbursed at a higher rate. So this is an example of the actual template that will pop up. You will see conditions listed here. If it has an asterisk next to it, it means that it has not been addressed this calendar year and really should be addressed. If it doesn't have an asterisk by it, it can still be addressed by you. You may want to touch base with the patient on some of those other conditions as well. So you'll highlight the condition, insert your impression and comments, then click Add. You can also access these from your assessment plan and also and add more detail from there as well. You're going to complete this visit as you normally do, checking to be sure everything has been addressed, looking for all gaps in care, adding your diagnoses. The diagnosis for this physical will be the physical with or without abnormal findings. And the HCC diagnosis will be added as well as the status and plan for those codes. All the orders needed should be documented, such as screenings, referrals, vaccinations, follow-up appointments, lab orders, all of that. Then you're going to create the patient plan. You can add plan details, patient education, community resources, or anything else. Once the plan is complete, you will then finalize the visit. When you're on the finalized template, there's no medical decision making. Simply calculate the code and verify that a preventative code was selected. This will be a G code, and submit the code and sign off the note as usual in your PAQ. Thank you for taking the time to watch this video, and thank you for making the straight Medicare physicals happen. This is a once-in-a-year type of physical. It's important that we get everything documented in order to be reimbursed for these visits. Thank you for your help with this.